You know, in the wild and rapidly evolving world of mental health, psychedelic therapy is showing some just incredible promise. But what if the secret ingredient isn't just the drug? Today, we're going to dive into some fascinating research that uncovers a secret and very, very human element to healing.
So there's this popular idea out there that psilocybin, the compound in magic mushrooms, is basically a magic pill. That it's a chemical that just flips a switch and resets the brain. But is that really the whole story? Or is the reality a whole lot more nuanced and honestly way more interesting?
Well, to answer that, let's take a look at a groundbreaking clinical trial. This study put psilocybin-assisted therapy head-to-head with a leading antidepressant. And it's right here that the researchers kind of stumbled upon something they weren't even necessarily looking for. Now, this wasn't just any study. We're talking about a double-blind, randomized, controlled trial. That's the gold standard in medical research. For our explainer here, we're going to zoom in on the 30 folks who got the psilocybin, because our goal is to really understand the mechanics of how this therapy actually works, not just if it works.
Okay, so to really get what this study found, we first need to get on the same page about 3 key ideas the researchers were measuring. And believe me, these aren't just buzzwords. They are the absolute pillars of the whole therapeutic experience they were tracking. First up, we have the therapeutic alliance. Basically, this is all about the quality of the relationship between you and your therapist. Think of it as the trust, the rapport, that feeling that you're really on the same team. It's the safe container that lets a person feel okay exploring some really difficult and vulnerable emotional territory.
Next, there's emotional breakthrough. And what's so interesting here is that this is not about having a blissful or fun trip. No, this is about catharsis, that incredibly powerful release you get from finally facing and working through tough, often buried emotions and memories.
And finally, the mystical experience. This is that huge, transcendent state a lot of people associate with psychedelics. We're talking about a profound sense of connection, of unity, and a feeling that what's happening is deeply sacred and meaningful, often in a way that's totally beyond words.
Okay, so you got those 3 ideas down? Good, because now we can get to the absolute core revelation of this research. And it's a finding that totally challenges that simple magic pill idea we started with.
What the researchers found was that the single most important factor wasn't the dose of the drug, it wasn't anything like that. It was the strength of the human relationship.
That was a direct predictor of success. Let that sink in. The connection between the patient and their therapist wasn't just a nice little bonus. In a therapy that's defined by a powerful chemical, this human bond was a core, active ingredient in the healing process itself.
So check this out. They basically uncovered this clear pathway. A stronger therapeutic alliance right from the start led to a much greater chance of having a powerful emotional breakthrough during the session. And that breakthrough, well, that led directly to a bigger reduction in depression. It's a straight line from connection to catharsis to healing.
This quote from the authors really just hits the nail on the head. Being in a psychedelic state can make you feel incredibly vulnerable, right? The trust you build with a therapist, that's the psychological safety net you need to actually let go, to surrender, and to do the deep emotional work that leads to real change.
But the story gets even cooler. The trial actually had 2 separate psilocybin sessions, and it turns out they each played a very different but totally complementary role in the healing journey.
So in that first session, the real driver of success was the emotional breakthrough, working through all that personal stuff. But by session 2, the mystical experience started to become a much better predictor of even more improvement. And here's the kicker. Having a weak alliance going into that second session was a direct predictor of a worse final outcome. That human relationship actually became even more important as the therapy went on.
This whole thing created this amazing feedback loop. Having that cathartic emotional breakthrough in the first session, it actually made the patient's bond with their therapist deeper and stronger. It set them up for an even more effective second session. The experience itself was nurturing the very relationship that made it all possible.
So, let's step back. What does all this mean for the future of mental health care? Why does this one finding matter so much as these treatments start to go mainstream?
Well, here are the big takeaways. First, healing is fundamentally relational. It's not just a chemical process, and that means therapist training and skill aren't just optional extras. They are absolutely critical for this to be safe and successful. It also suggests we can personalize the treatment. If that alliance feels a bit weak early on, maybe you postpone that second dose and do more therapy to build that bond first. It completely flips the script from a magic pill to a deeply supported human process.
And this brings us to a really crucial warning from the authors themselves. As psychedelic medicine becomes a big business, there's going to be huge pressure to cut costs. This research is a powerful scientific argument against cutting corners on the human support that, as we've just seen, is what makes the treatment actually work in the first place.
So think about it. This study used a powerful chemical that helped reveal just how profoundly important human connection is for healing. But if that connection is this essential in such a potent therapy, what does that tell us about its role in all forms of mental health care? What might we be overlooking in our endless search for the next magic pill?